Did you know that each year, around 240,000 Americans experience a transient ischemic attack, TIA, commonly known as a mini-stroke? Despite their brief and seemingly harmless symptoms, these episodes are far from innocuous. In fact, about 1 in 5 individuals who suffer a TIA will go on to experience a major stroke within 90 days, with the elderly particularly at risk. Think of a TIA as your body's urgent warning signal, a red flag indicating serious trouble ahead. Recognizing these symptoms early and acting swiftly can literally save lives. The problem lies in that these fleeting symptoms are often easy to ignore or misdiagnose. It's crucial to stay informed, especially if you or a loved one is older. Let's dive deeper into how understanding these warning signs can help prevent a life-altering stroke and what steps you need to take. A mini-stroke, medically referred to as a transient ischemic attack, TIA, is a temporary interruption of blood flow to the brain. It's like a small-scale warning. A blockage occurs, briefly cutting off oxygen, but the effects typically resolve within minutes to hours without causing lasting damage. Unlike a full-blown stroke, which can result in permanent disability or even be life-threatening, a TIA serves as a red flag signaling that a major stroke could be on the horizon. While a stroke causes long-term brain damage, a TIA does not, at least not immediately. However, it's not something to ignore. Studies show that TIAs are most common among the elderly, with about 15% of individuals over 65 experiencing one at some point. Recognizing these episodes as a warning and seeking medical attention immediately can be the critical step to preventing a more severe, life-altering stroke. Understanding why recognizing a mini-stroke or TIA is so crucial is because it's often a precursor to a major stroke. Studies reveal that about 1 in 3 individuals who experience a TIA will go on to have a full-blown stroke, with nearly half of these occurring within the first 2 days after the TIA. Ignoring the symptoms can have severe consequences. A major stroke can lead to severe neurological damage, permanent disabilities like paralysis or loss of speech, and even death. But the good news is that catching a TIA early gives doctors the chance to intervene. Medications, lifestyle changes, or procedures can significantly lower the risk of a larger stroke. Recognizing the signs and acting quickly isn't just important. It could be the key to preventing long-term complications and preserving your quality of life. The 8 warning signs of mini-strokes in the elderly include 1. Sudden weakness or numbness. This is one of the most common indicators of a mini-stroke or TIA. It typically affects one side of the body, such as a drooping mouth, an arm that feels heavy and hard to lift, or a tingling sensation in the leg. These symptoms last only a few minutes to an hour but shouldn't be ignored. They occur because a mini-stroke temporarily blocks or narrows a blood vessel, reducing oxygen supply to a specific region of the brain. 2. Temporary vision changes. Sudden vision changes like blurriness, double vision, or temporary blindness in one or both eyes are serious indicators of a mini-stroke. One specific condition associated with TIAs is amaurosis fugax, a temporary loss of vision, often in one eye. This occurs due to a lack of blood flow to the retina, signaling that a major stroke could be imminent. If you or a loved one notices these sudden changes in vision, seek medical attention immediately. Addressing the issue early could prevent a life-threatening or disabling stroke. 3. Difficulty speaking or slurred speech is another significant warning sign of a mini-stroke or TIA, transient ischemic attack, and it often surprises people due to its sudden onset. This symptom can manifest as trouble forming words, speaking clearly, or even understanding what others are saying. You might feel like the words are on the tip of your tongue, but they just won't come out right, or they might come out jumbled. This difficulty in communication is often linked to a condition called aphasia, which is a temporary inability to process or express language due to reduced blood flow to the areas of the brain responsible for speech and comprehension. When a mini-stroke occurs, even for a few minutes, it can disrupt these regions, leaving you struggling to communicate clearly. People around you might notice slurred or garbled speech, or you might find it difficult to follow what they're saying. These symptoms may only last a short time, but they are not something to dismiss as stress or fatigue. TIAs are warning signs of a larger stroke that could result in permanent damage to your ability to speak or understand. If you or someone you know experiences sudden speech difficulties like this, don't hesitate. Seek medical attention immediately. Early action can make all the difference in preventing a more serious stroke. 4. Sudden confusion is a warning sign of a mini-stroke that can easily be mistaken for something less serious, like fatigue, stress, or even early signs of dementia. This symptom can manifest as difficulty concentrating, disorientation, or trouble remembering simple things. You might feel mentally foggy, unable to process information, or even confused about where you are or what you're doing. This cognitive impairment occurs because a mini-stroke disrupts blood flow to areas of the brain responsible for thinking, memory, and problem-solving. Even though these symptoms usually last only a few minutes to an hour, they are a clear signal that something is wrong. Unfortunately, this confusion is often dismissed in elderly individuals as part of aging or memory lapses, which can delay critical medical attention. Here's what's important to understand. While dementia develops gradually, sudden confusion from a TIA is abrupt and temporary. It's your body's way of sending a loud warning that the brain isn't getting the blood supply it needs. Ignoring it increases the risk of a full-blown stroke, which can cause permanent cognitive damage. If you or a loved one experiences sudden confusion, don't second-guess it. Get medical help right away to protect brain health and prevent long-term complications. 5. Dizziness or loss of balance can also be a key warning sign of a mini-stroke or TIA. It might feel like the room is spinning, you're swaying, or you're unsteady on your feet, often leading to unexpected falls. For many older adults, this symptom can be confusing because it's easy to attribute dizziness to something like dehydration, low blood sugar, or even an inner ear condition such as vertigo. However, while inner ear problems affect balance by disrupting signals from your ear to your brain, dizziness caused by a TIA has a very different underlying cause. In the case of a mini-stroke, the problem lies with blood flow. When blood supply to the areas of the brain responsible for coordination and equilibrium is temporarily disrupted, you may experience sudden, unexplained balance issues or dizziness. The key difference is that dizziness related to a TIA often appears out of nowhere and may accompany other warning signs like numbness, vision changes, or difficulty speaking. While these episodes might pass quickly, they are not harmless. They are a critical red flag that your brain isn't getting enough oxygen. If you or a loved one experiences sudden dizziness or balance problems, seek medical attention immediately. It could prevent a serious stroke down the line. 6. Severe headaches are not the most common symptom of a mini-stroke or TIA, but they can occur in certain cases, especially if there's vascular stress or a sudden change in blood flow within the brain. These headaches tend to come on quickly and feel different from your typical tension or migraine headaches. They're often described as sharp, intense, or unusual. Why does this happen during a TIA? A temporary blockage in a blood vessel can trigger changes in pressure or irritation in the blood vessels of the brain. While TIAs generally don't cause permanent damage, the stress on the vascular system may lead to sudden, unexplained headaches in some individuals. It's important to recognize the difference. Unlike regular headaches, TI-related headaches may come with other warning signs such as dizziness, vision changes, slurred speech, or numbness. These additional symptoms are key indicators that the headache could be part of something much more serious. For elderly individuals, sudden severe headaches should never be dismissed as just a headache. If they're accompanied by any other neurological symptoms, they could signal a TIA or even a larger stroke in progress. Seeking immediate medical attention could save your life or prevent long-term complications. 7. Brief loss of consciousness. such as fainting or suddenly feeling unusually drowsy, can be a significant warning sign of a mini-stroke or TIA, transient ischemic attack. While it might be tempting to attribute these episodes to dehydration, low blood sugar, fatigue, or even stress, they can signal something far more serious: a temporary disruption of blood flow to the brain. The brain relies on a constant and steady supply of oxygen and nutrients through the bloodstream to function properly. Even a momentary interruption caused by a TIA can result in lightheadedness, extreme weakness, or a complete loss of consciousness. This occurs because a mini-stroke temporarily blocks or narrows a blood vessel, limiting the oxygen and nutrients available to the brain. Depending on the area of the brain affected, this disruption can manifest as fainting, unusual drowsiness, or a sudden, overwhelming sense of fatigue. Although these symptoms are typically brief and resolve on their own, they should not be ignored. They are a red flag indicating that the brain is not getting the circulation it needs, and they serve as a warning that a more severe stroke could occur in the near future. What makes this particularly concerning is that many people, especially older adults, dismiss such incidents as harmless or insignificant. However, ignoring a sudden loss of consciousness could lead to devastating consequences, including a major stroke with long-term or permanent effects. If you or a loved one experiences fainting or unexplained drowsiness, don't delay. Seek immediate medical attention. Early intervention could save a life or prevent significant complications. 8. Tingling sensations, often described as a pins and needles feeling, can also be an early warning sign of a mini-stroke or TIA. This sensation typically occurs suddenly and is usually isolated to one side of the body, such as an arm, leg, or even the face. While it might seem minor or easy to dismiss, this symptom is not harmless. It often indicates that blood flow to a specific area of the brain has been temporarily interrupted. When blood supply to the nerves controlling sensation is disrupted, even briefly, it can result in tingling, numbness, or a similar unusual feeling. The challenge with tingling sensations is that they can easily be mistaken for more common issues like a pinched nerve, carpal tunnel syndrome, or sleeping in an awkward position. However, TIA-related tingling is different. It usually occurs without any physical cause, comes on suddenly, and may appear alongside other symptoms such as dizziness, vision changes, slurred speech, or weakness on one side of the body. This combination of symptoms is a critical indicator that the issue lies within the brain, not the peripheral nerves. If you or someone you know experiences sudden, unexplained tingling, especially if it's localized to one side of the body or occurs with other neurological symptoms, do not dismiss it as harmless. These sensations could be a vital warning of a larger stroke on the horizon. Seeking immediate medical care can prevent serious, life-altering complications. Risk factors for mini-strokes in the elderly. Mini-strokes or TIAs rarely happen randomly. They are typically the result of underlying health conditions or lifestyle factors that increase the risk of blood flow disruptions to the brain. Among the most significant contributors is high blood pressure, hypertension, which puts excessive strain on blood vessels and makes them more prone to blockages or narrowing. Diabetes is another critical factor, as it damages blood vessels over time, further impairing circulation. An irregular heartbeat, such as atrial fibrillation, AFib, also significantly raises the risk of TIAs by causing blood clots that can travel to the brain. Other heart conditions, like congestive heart failure or valvular disease, further contribute to the likelihood of blood flow interruptions. Lifestyle choices can compound these medical risks. For example, smoking damages blood vessels and increases clotting tendencies, while obesity and a sedentary lifestyle weaken cardiovascular health and circulation. Together, these factors create a perfect storm for mini-strokes and significantly heighten the risk of progressing to a full-blown stroke. Prevention and early action. When it comes to mini-strokes, time is critical. Acting quickly within the golden hour after symptoms begin greatly increases the chance of preventing long-term damage. Using the FAST method, checking for changes in face, drooping, arms, weakness, speech, slurred, and noting the time symptoms began, is a quick and effective way to assess for a TIA or stroke. Healthcare providers rely on diagnostic tools such as MRI scans, CT scans, and carotid ultrasounds to identify blockages or damage in blood vessels. These tests allow for timely treatment, which may include medications to reduce clotting, procedures to open narrowed blood vessels, or lifestyle interventions to improve overall cardiovascular health. Recognizing these warning signs and acting promptly could save lives and significantly reduce the risk of a major stroke. If you've experienced a mini-stroke, TIA, or are at risk of one, addressing the issue without delay is crucial to preventing a more severe stroke. The encouraging news is that there are highly effective treatments and prevention strategies available to minimize your risk and safeguard your health. Medical treatments. Medications are a cornerstone of TIA prevention and management. For many, antiplatelet drugs like aspirin are prescribed to prevent platelets, a type of blood cell, from clumping together and forming dangerous clots that could block blood flow to the brain. For individuals with heart rhythm disorders such as atrial fibrillation, AFib, doctors often recommend anticoagulants, commonly known as blood thinners. These medications reduce the risk of clots forming in the heart and traveling to the brain, which could lead to a stroke. Lifestyle modifications. While medications play a vital role, lifestyle changes are equally important. 1. Heart-healthy diet. Adopting a diet rich in fruits, vegetables, whole grains, lean proteins, and healthy fats, like those found in avocados, nuts, and olive oil, can significantly lower cholesterol levels and improve vascular health. 2. Regular exercise. Incorporating even light physical activities such as walking, swimming, or yoga helps maintain a healthy weight, reduces blood pressure, and enhances circulation. 3. Quitting. Smoking. Smoking damages blood vessels, promotes clotting, and accelerates vascular aging. Quitting is one of the most effective ways to reduce stroke risk. 4. Limiting alcohol. Reducing alcohol consumption further supports overall cardiovascular health. Consistently managing chronic health conditions like high blood pressure, high cholesterol, and diabetes is critical. These conditions directly impact the health of your blood vessels and the likelihood of clots or blockages. Regular monitoring, taking prescribed medications as directed, and working closely with your healthcare provider to keep these conditions under control can significantly reduce the risk of another TIA or a major stroke. Prevention is not just about avoiding health problems, it's about actively protecting your long-term brain and heart health. By addressing risk factors now, you're investing in a healthier, longer life. How families can support elderly loved ones. Supporting an elderly loved one who is at risk for or recovering from a mini-stroke requires awareness, encouragement, and consistent care. Families play a pivotal role in ensuring their loved one's safety and well-being. 1. Recognizing symptoms. Early. Elderly individuals may not always notice or understand the seriousness of symptoms such as slurred speech, sudden confusion, or numbness. Family members should learn to identify these signs and take action immediately. Even subtle symptoms should prompt a call for emergency assistance. Time is critical in preventing a major stroke. 2. Encouraging routine checkups. Regular visits to healthcare providers to monitor blood pressure, cholesterol levels, and other risk factors are essential. These appointments ensure timely detection and management of conditions that contribute to stroke risk. 3. Promoting healthy habits. Help your loved one embrace a healthier lifestyle by making it a shared effort. Cook heart-healthy meals together or join them for walks and light exercises. These activities not only improve health, but also make the process less daunting and more enjoyable. 4. Providing emotional and practical support. Recovery or prevention efforts can be overwhelming, especially after a TIA. Offer to assist with transportation to medical appointments, provide reminders for medications, and reassure them during this challenging time. Your presence, patience, and understanding can significantly boost their confidence and motivation to prioritize their health. Mini strokes, TIAs, are not minor events. Although their symptoms may seem brief or harmless, they are critical warning signs of a potentially life-threatening stroke. These episodes indicate that something is seriously wrong with the brain's blood supply and demand immediate attention. Recognizing the signs early, seeking prompt medical care, and taking proactive steps, such as managing chronic conditions, making lifestyle changes, and adhering to prescribed treatments, can make all the difference. Awareness and timely action don't just reduce the risk of major strokes, they can save lives and preserve quality of life. By educating yourself and those around you about the symptoms, risk factors, and prevention strategies for mini strokes, you can help protect yourself or a loved one from the devastating effects of a full-blown stroke. Every step toward prevention brings hope for a healthier, longer life. Together, we can transform awareness into action and create more positive outcomes for those we care about. Stay informed, stay vigilant, and stay proactive.